Hi, welcome to the Osteopathic Center podcast. This is the 15th, and I'm here with Dr. Morse today, and we're going to be talking about high ankle sprains. So, we're just going to jump right in. Okay, so we're going to show you two models here. One is a small foot model, and the other one we got a little bit longer because we're going to have to show you some anatomy here. So, most people end up spraining their ankle at this low part, and that's the low ankle sprain.
Let me go that a little bit better, yeah.
Okay. And so we see the same thing here, right there. But what we're talking about today is we get up into what we call the syndesmosis between two bones, and that's this. And there's also ligaments that attach these two bones. And again, it's right here and right in there. And it can carry up all the way through this area. And so it just depends on what kind of force was actually used in order to create the injury itself. Dr. Morse, give your thoughts on the high ankle.
So this is a very, very frustrating injury. This is not your traditional ankle sprain. Traditional ankle sprain, you happen to step off a curb, it rolled out, not a big deal. Even if it's a grade 2, maybe you're out, 2-3 weeks, a month at the most. High ankles are a special monster. 3 weeks at a minimum, much longer for grade 2s. Grade 3s almost always go to surgery. These are very frustrating injuries, particularly because the person doesn't even want to put their foot on the ground. It is that painful. It is uncomfortable. Every time when you put your foot on the ground, the purpose of this ligament is to keep these two bones tight so that the ankle joint is tight. But what happens is when these are torn up, the bones, every time you put your foot down, the bones want to separate. And when that happens, the ankle joint can't accommodate that, and they get a lot of pain. A lot of people will have bruising and then what we call the capsule down here. You can have other little ligaments, injuries we'll talk about. This is pretty much more common in sports injuries, not super common in everyday life, but obviously can happen. Much more common in football than American football than any other sport. Several big name athletes that are usually very, very injury averse. They don't get many injuries. When they get this, they're shut down for a month, 2 months. LeBron James has one right now. That's how bad these injuries are. Is that as athletic as someone is, these can shut them down in their tracks because of how important this area is and how frustrating it is because it doesn't heal. So they're just, when I hear it, I'm like, oh. Yeah.
Yeah, you're completely right. I mean, these can be very frustrating injuries. And so, the typical rehab, I mean, at the end of the day, it's a very variable situation as to how people and sports players return. And so if it's very mild, maybe out a couple weeks. If it's severe, we've seen people miss 3 months. So, and this gets into a little bit of what we see as, we have our main injury at the sprain, but when it's really bad, we end up seeing other ligamentous structures torn, and that's when we start to see compounding factors, and that's what keeps people out for long periods of time. Now, how do we treat this? I'm going to let Dr. Morse talk about the conservative ways to treat it, and then I'm going to talk about the regenerative ways that we can treat this and get people back on the field much more quickly than traditional.
So these have predominantly 3 grades: 1, 2, 3. Unlike the little lateral classic ankle sprain where grade 1s most people can even play on, they're just a little banged up, but they may miss a couple days. Women maybe don't wear high heels for a couple weeks because they don't feel stable, but day-to-day life is pretty normal. A grade 1 high ankle is a minimum of 3 weeks up to 4, and that's considered completely normal. And if people return too quickly, they will have a setback and they will likely go backwards and end up needing even more time out. That happens a lot. So traditionally, you're going to rest them, you're going to ice them up. Once all the swelling is decreased, they can finally put their foot down on the ground without any pain or with minimal pain. Then they start strengthening up. One of the things that a lot of the athletes will tell me who have suffered these, and unfortunately we've had several recently, is that they lose what we call proprioception in the foot. So when they close their eyes, they don't know which way their foot is facing because of this injury, it just happens to correlate with that. So they really struggle with finding where their foot should be versus where it is, and that takes a long time to get back. Grade 2s, a lot of the times they're going to shut them down for probably 3 or 4 weeks. They may even consider some injections, which we'll talk about in a sec. But when you have that level of injury, there's usually other smaller injuries that played a role, because there's a lot of force involved in order to get that type of injury to that extent. Grade 3s, that would basically mean that both parts of the ligament are completely torn in half. You may have several other areas. You may even have a fracture. At that point, they do something that is almost always surgery. That they do something called a tightrope procedure, where they go in, they put almost like a piece of rope here and here, or depending on how bad it is, how high it is, and they will tighten it up and literally pull everything back together. If there's a fracture, obviously that's a separate discussion. But those are months and months of rehab. These are awful injuries. The problem with even the milder ones is that you want to get back to normal, but the faster you go, the worse it becomes. You have to take your time with these, unfortunately.
Yep. Yeah, and so that's the traditional approach. So we can facilitate the healing with a regenerative approach. And so if we're using a stem cell treatment, and again, we've discussed stem cells in other podcasts, and there are different ways to get that. And the term doesn't really mean what a lot of people thinks it means every day. But we can use that kind of product. We can use platelet-rich plasma or even prolotherapy. And what we can do is actually regenerate the tissue. So again, what it is this what we call syndesmosis. It actually gets stretched apart and actually tears. So now we have a lot of laxity. Every time you put weight on, these two bones are coming apart. And so the more weight you put on it, the more activity you do, you have a higher risk of actually letting that tear more and more. So that's why rest is a big thing. So if you're an athlete, the time to do this is immediately, because we can go in and inject this syndesmosis. We can inject any kind of ligament injury and start healing immediately. Some people want to be conservative, and non-athletes, nobody, if you're not making your livelihood with your body, we can give it time, because maybe you do heal in a month, in 2 months. But if you want to heal quickly, we go ahead and inject this within days of the injury, and we will see benefit and the healing response happen much more quickly and get somebody back on the field. We've had 2 people in the clinic recently. One was very severe injury, another one was a mild injury. And both individuals, one person was able to play after 2 weeks, another one was able to play, still hasn't played actually, and it's been 3 to 4 months. But they both still have lingering effects. And so we were able to inject both of these individuals with a regenerative product. And that created less inflammation, because we saw muscle inflammation that goes over top of the syndesmosis. And that's a very reactive thing to have happen when you have this weakness. And then was able to go down and inject the syndesmosis directly. And within a week, that inflammation, pain, and limping went away. The other individual had much more going on, tears, as well as a syndesmosis injury. So our best goal there is we're just trying to keep it as stable as possible and take away some of the inflammation. And we're still evaluating the progress, but the first individual is returned to full activity again. The second individual is currently in the healing phase of our procedure.
Yeah, these are particularly, even for the athlete or for anybody that happens to have this, traditionally this would happen, basically, let's see if I can get this to roll. Traditionally these happen with this type of mechanism, where someone will accidentally hit the back of their toe, or some type of movement like this, where someone lands on their heel and their toes are jammed in. That causes this to basically rupture. There are a couple ways to do it. That's one of the common ways that I've seen it happen a lot. And as I said, the issue with these is you want to give it rest, but you also want to get back to normal, and there's no happy medium. And depending on what you do day to day, how high level your activities are will depend on how much you need to be able to move. and some of the high level athletes, they need to be able to turn on a dime, and that is just not possible with a high ankle very quickly. Those are the ones that take months and months and months to return, to finally get that final, oh yeah, I feel normal again. And then some guys never feel that because the tear is so bad that they'll never get it to heal without surgery, or feeling like it's still a little loose. It still gives a little bit of play where I don't want it to move that much. So I mean the not super commonly talked about because of that, but in general, very frustrating injury.
So the next topic, is really just, we're kind of summarizing up now, but we do need to talk about imaging a little bit. MRI and X-rays are the staples. X-rays looking for avulsion fractures or any type of fracture from the forceful injury that caused this. And then MRIs are able to show us the ligament, tendon structures, and the any deep inflammation associated with the syndesmosis. Now, ultrasound we do utilize as an adjunct, and one of our patients recently, we were able to see a lot of fluid inside the muscle right around the syndesmosis area. So we can and try to use all of our skills when we're diagnosing this, and of course, physical exam is of utmost importance. And really, these are frustrating injuries, and the quicker we can treat these with regenerative injections, the faster an athlete can get on the field. And if you're just somebody, weekend warrior, or just somebody who's chilling out at the house, if you want to get better quicker, you start with regenerative injections, or you can delay and try to see if it'll heal on its own and do physical therapy. And if not, then we'll end up doing the injections.
Yeah, I mean, the only thing I would add is if you don't want to struggle for months and months and months, or you're trying to get back to something very specific. I had a gymnast who was struggling to stay on the beam because of a high ankle that just never healed. So it just took a little bit of a touch up with an injection to finally get her able to feel her feet and her ankle, so that she didn't have to constantly look down and actually could focus on what she was doing. So sometimes it's the subtle things that end up making the biggest difference. So frustrating injury, not something you can return from in a week or two. Thankfully, not super common in everyday life, but at the same time, you want to take it seriously, and you want to make sure A, that there's no fractures, and then B, that you address it early on, because if not, it will take over your life, and you will be dealing with it for months and months and months. So that will do it for this podcast. If you have any questions,